experience, the tools that we share with you as well. So you can have a think about how you might use appreciative inquiry and how you might use some of the resources in your practice. So there is a series, but they are standalone sessions as well. So every session we will give you a little bit of a background about what appreciative inquiry is all about. And then, like I say, we'll add in some new tools and things. And we've based them around the grounding statements or the principles of appreciative inquiry, which Louise will be talking about in a little while as well. So this is webinar number 4, Stories of the Heart and Soul of an Organisation and Help us to learn what we care about, which, like I say, is one of the grounding statements or the principles of appreciative inquiry. We are going to record today, so I hope that's okay with everybody. I think the recording's just started. And we've been able to record the other webinars that we've done so far, and we've popped them on YouTube as well. So at the end of this, we will share with you the link to the resources on YouTube so that you can get in there easily if you want to revisit one of the webinars that we've already done, so that maybe there was some tool or something that you really liked in there and you might want to kind of just revisit and have another little look at it. Or if you like Michelle, haven't managed to get to some of the other ones so far, they're going to all be there on YouTube as well, so you can just go in and have a look whenever you can. Yeah, so it's nice to see your faces. I mean, it's lovely that we can do this virtually nowadays. This is the new world, isn't it? It would love to add. I mean, I still love face to face, but this is good that I can see your face and we can facilitate this way and connect this way. And it really does help if we can see you. Helps with the connectiveness, and that's really what appreciative inquiry is all about. And it is about this building of relationships and the connections that we make, so that we can find out what matters to people and do more of the things that we like and the things that are going well and that kind of thing. So I'm not going to make any assumptions. Is everybody okay, first of all, with this virtual space that we're in? Does anybody want any help with the chat function or turning on your cameras or anything like that? All good. Right. Okay, next slide then, please, Lou. So I'd like to acknowledge the traditional custodians on whose beautiful land we stand today. And pay our respects to the elders past, present, and emerging, and any Aboriginal colleagues that we have with us here today. So welcome. I was off site this morning and then I came into Sutherland Hospital. We're in Darawal country, down in the basements of Sutherland Hospital. That's where Lou and I are at the moment. And I parked my car here at the back of the hospital. And you can see right over to the national park, and it's just beautiful, all the trees, and yeah, it is really gorgeous. And it's such a lovely day, like the sun's shining and everything. So yeah, very fortunate to be on these beautiful lands. Okay, next slide then, please, Lou. Okay, so like I said, we're sharing resources with you as we go. So appreciative inquiry resources, and the ones that we're sharing are by from Belinda Dewar's work, which Louise will talk a little bit more about in the moment. So we just really want to bring you into this space. So these resources that we use, and this is a virtual resource that we're going to use today, a virtual activity, they're purposeful in the fact that it's to try and bring you into the space. So I don't know how hard it has been for all of you to get here into this space and the space that you've left behind, whether you've just been busy doing clinical work or you've been in another meeting or whatever it might be. So that's kind of like to close off the space that you've come from and make you present into this space. That's why we use a resource like this. The appreciative inquiry resources are all around conversations and questions. It's all about language. So these resources like this one, it's around questions, and this is a virtual key jar. So when we give it a shake, it's going to come up with some questions that we can ask or ask ourselves. And really, the purpose is for this this connection, really, and to help us feel a bit more safe in the space. Like psychological safety is a great thing, because we know that if we can get a bit of safety going, and that's when we can do our best thinking and be innovative and all those great things and kind of be the best people that we can all together. Can
I ask a quick question?
Sure.
I don't know if this is the same for anyone else, but I'm still on the first slide, so there's a lag between what what you're controlling, and maybe that's only for me.
How about everybody else?
No, we're the same. Ours hasn't changed.
How weird.
I can see the new slide, the jar.
Yeah.
So can I.
How
I can see it
bizarre.
now. It's just come up.
That's a big lag because that's been there for a little while. Wow. Okay, thanks, Andrew. That's good to know. Just jump in if you,
What do we call that? The bandwidth? Is the bandwidth slow?
Or maybe. Is it worthwhile perhaps sharing the slides on the through the meeting invite, and we can click through the slides ourselves as well, just in case that lag continues.
Okay. I shall do that now.
Okay, so Andrew and everybody else on the screen at the moment, can you see something like a little jar that says press to start? Yeah, awesome. So that's the key jar. So thanks, I'm glad you jumped in there, Andrew. And if anybody's got any other problems or can't see or whatever, just jump in at any time and let us know. Okay, so this is a key jar, and this is a virtual resource, like I say, but you can do this face-to-face as well. This you can either get some little questions on some cards and ask them that way. But with this one, it's pretty cool. You shake it virtually and it'll come up with a question. One of the things that we have, one of the principles of appreciative inquiry is that we don't do on people. So we're not going to force you to share or do anything that we're not going to do. If there is a question that doesn't land or sit well with you, or you can pass. What we would ask though is to try and build this connection is for you to have a go though. So you can pass, and if you don't want to answer it, and you're in charge of what you share. So just be aware of that. That's up to you what you would like to share. We're not going to force you to share more than you want to share. Okay.
Oh, sorry. That's me trying to share the slides. All right. Ready?
Okay, yeah, so I'm going to go first, and what I'm going to do is I'll answer the question, or I might pass if I'm, it doesn't sit well with me, and then I'll throw to somebody else, and we'll kind of go around the virtual space like that, answering the question and then throwing to somebody else.
Yeah,
if that's okay.
And just when we say pass, it might be passing on that one. You can always pick another one from the jar.
Great. Go
Where
then, Lou.
Ready?
Yeah.
Where is my? It's not shaking. Oh, there we go.
Okay, it's shaking now. Oh my gosh, what do you think is one of the hardest things in life? Oh golly.
Answering questions on the fly.
Yeah. Yes. Oh, do you know what? I know. What is one of the hardest? I just think the whole work-life juggle thing. It's just, there's so much time that I want to give to things that I don't have the time for, like I want to spread myself too thinly, I think. But I'm just about to have a month off nearly. So there'll be some things there that I'll be able to do more so that I just haven't been able to get to. So I think I'll just really enjoy those. I think that's the hardest thing. We live life really fast, don't we? There's a lot going on, which is good and fun, but yeah, that's it. I think that's hard, just trying to spread yourself too thinly. So that's me. So Lou, I'll throw to you.
You're on mute, Lou.
Thanks, Ruth. Is there something I would like to learn in the next year? Yes, I would like to learn how to dribble the ball in soccer so that it looks like I know what I'm doing. Because at the moment I can pass and all of the other stuff, but I'd like to sort of be able to dribble and cover some distance. So what might do is just throw it out to the next person, and then when you're finished, if you just throw it to the next person too. So I'll throw it to you, Ruth.
What is my priority for today? I have a couple of appointments after work, so I've got to finish some stuff and get out the door and get through those appointments, and yeah, nothing very exciting. I'm going to throw to Dan. I'm going to press the button. Can't hear you, Dan. Still can't hear you. You're not on mute, but we can't hear you.
Dan, do you want to just write it in the chat box if that's a little bit easier for you? While Dan's typing, I might just maybe ask Michelle to jump in. Dan's copy Fifi.
Oh, that's nice, Dan.
Yeah.
So when do I feel truly comfy? A couple of different places. You know, that thing first thing in the morning when you wake up and your bed's just the right comfortable temperature, and like I've got a really nice comfy bed, and you feel rested and just ready to get going when you've just had a few minutes to just lie there and savor that comfort. Yeah, it's one of mine. I might throw to Andrew.
All right, Andrew.
What difference would you like to make in the world? Wow. I think I can make a difference here at work just by supporting my team. And I'd like for that to be noticed and important to my team as well.
Thanks, Andrew.
I'm just having a look who to throw to. Can I throw to Jackie?
Yeah. All right, Jackie.
Oh God.
No pressure.
Yeah, can I go again? That's too
sure.
broad. Maybe it's a better one. Not worse. What's been the best change in the world over the last 50 years? Best change in the world over the last 50 years. Yeah, yeah. Half of the EMR, half of our notes going from paper to online.
There you go. Do you want to throw in the room to you guys?
Yeah, sure.
Aoife, Mary, Jodie.
Amelia, come on. I'll throw to Amelia.
Okay, Amelia.
Oh, I don't know what kids know these days. We played a lot of Marco Polo in the pool. I don't know if that's still a thing. Is it?
I think it is.
Yeah.
Yeah.
Marco Polo.
Thank you.
Oh, I don't know if it was through.
What about Mary or Jodie?
What? Mary or Jodie? No. Jodie. I don't know. To Jodie.
Okay.
Okay, fantastic. Thanks, Jodie. Wow.
What did you dream about recently? Being at work. A lot about being at work. I'll
Thank
throw it
you.
to Mary.
Thanks.
Who do you think has a great life? Great life.
Who do you think has a great life?
Dogs.
Yeah. Yep.
Definitely. Yeah. Thanks.
Thank you.
All of us.
That's all of you. Is that everybody? Is that
Wendy.
everybody? Wendy. Do I never go, Wendy?
Sure.
Are you there? Okay, great. What kind of community do you have? Would you like to have?
I think a community that brings up a community well. So inclusiveness. And I'm noticing that with my grandchild living with me is it takes a community to bring up a child, and I think that's what I'd like to see. Yeah.
Thank you. Thanks everybody for sharing. That's everybody now, isn't it? And do you know what I was just thinking? I didn't even introduce myself. I just made the assumption that I knew everybody. But so my name's Ali, for the people I haven't met yet, especially Jackie's team there. I've met Jackie, but not the others. So my name's Ali, in the nursing and midwifery practice and workforce unit, and Louise is here too. And normally we have Jules in this space as well, but she's not here today. So, did anybody notice anything from doing that? Is there anything that they noticed for being in part of that? Anything that they liked?
Everyone became more present in the room, I think, definitely.
Thanks, Ruth.
I think too, Ali, that you can sort of start to get a sense of people that you may not have met before, and or even people you have met before, and just get a bit of a sense of what's important to them and what they value.
Yeah, great. Thanks. And Dan said some things in the chat there as well, didn't he? Let me get my chat up. Yeah, created some fun and laughter and a bit more of a relaxed vibe. Yeah, great. Thanks.
Yeah, absolutely. And I also noticed as well that there was an element of maybe apprehension in some of the questions because they do go a little bit deeper. And that's kind of purposeful in recognizing that a lot of the people who are in the space today have been on with us before. And it also creates maybe a bit of a deeper connection and maybe understanding a little bit more about what makes people tick and what matters to them. So we appreciate you guys sharing, and also throughout the webinars we're going to be using different tools like we've seen already that hopefully you guys can take into your own practice and use yourself.
Great, thanks. So next slide, Lou.
Okay, so a few of you will have seen this slide before. So what we've done is we've created the webinars on video, and they're in the YouTube link, as Ali said, which we'll share at the end. So as people are gaining access to that, then this part of the AI and the explaining and going into what it all is might become a less in-depth or repetitive. But really, what is appreciative inquiry? It's looking at what matters to us, it's looking at what works well, and how we can do that more of the time. It's a change methodology that focuses on the positive and what's possible. And as we know, sometimes we sit in that deficit space and we look for problems and we look for things that are what's wrong and what we need to fix. But often when we sit in those spaces of looking for problems, we find more. And this is a way of working that brings energy to the workforce as well. And it was originally developed by David Cooper Ryder, but more recently adapted by Professor Belinda Dewar, who we work with in Southeast Sydney, and a lot of her tools and ways of working and adapted models are what we are using in our own practice that we're sharing with you guys. So appreciative inquiry is underpinned by a set of core principles, but they're now sort of known as grounding statements, and that helps guide us into, I guess, and through an appreciative lens. So I've said it already, like what we focus on grows and expands. So we're trying to focus on what's possible, what matters to us. We are experts of our own experience. So if you think about the tool that we just used there around the key jar questions, that helps us understand people's own experiences and things that matter to them, and it helps us challenge our assumptions. Curious questions are an action in themselves, so asking questions can ignite a conversation to go in a certain direction. It can create new insights and thoughts around what we could maybe do differently, or again, what's possible. Probably the best one I would say is we can't change other people, we can only change ourselves. So that's something that I guess I would be, I guess, constantly working towards. And as we say, stories are the heart and soul of an organisation. So that's why we're sharing stories today. And as we move forward, we're going to look at capturing a story and unpacking that. Words create worlds, and that sits very closely with, we're experts of our own experience. Language and the way that we speak to each other lands on people differently, and a lot of that sits based on our experiences, where we come from, what we've been through. So a lot of the work with appreciative inquiry is around language and using not necessarily positive language all of the time, but language and being mindful of how it sits and lands on other people. And we work with people rather than on. So yeah. So the how of AI is the caring conversations, and again, this will be familiar to some of them, to some of you on here today. But the caring conversations were generated by Belinda Dewar. This framework came to light in 2017, and it's really the how. When we're guided by these ways of connecting on a deeper level and building and developing those relationships, then those grounding statements and I guess that deeper connection comes to life. So a lot of the tools that we're using and a lot of the way that we work enables these caring conversations and these threads to pop. So yeah, that you'll see them feature throughout each of the webinars. And if we think about it as well, just to give you a little bit of an example, is when we're trying to celebrate, it's about looking inwards and things that we notice that have touched us in order to celebrate outwards. So if we think about some of the questions that we were asked in the key jar questions, it's asking us for things maybe that we've noticed or that matter to us, but when we say it out loud, it brings light, but it also creates connection. So for the purpose of this webinar, what we're going to do is we're going to focus on stories being the soul of an organisation. So we thought maybe what we would do is a bit of a role play and demonstrate to you guys us using a tool that helps us to capture a story called emotional touch points. And then I'm going to capture Ali's story, and then we'll have a bit of an opportunity to, I guess, take a bit of a deeper dive after Ali shared her story. So for anyone who's not familiar with this tool, emotional touch points is really a tool that helps us create a bit of structure and guide us through capturing a story from potentially a patient, a consumer, family, carer, staff. And touch points really are just points in someone's experience. So if we think about if we were taking a story from a patient, their touch points might be around meal times, or it might be around the ward round, or it might be speaking with the doctors. Like, it's just those key points in their journey. So for the example that we're going to use today, our touch points here are based around Ali's experience with the webinars and AI and whatnot. So there's also a blank one there, which we would also use in real life as well, because it gives the person who's sharing their story an opportunity to actually choose something that might not be front of my mind or your mind. And then we have emotion words, which we'll see on the next slide that I'll share with Ali, to enable her to choose either positive emotions or negative emotions around her experience. But again, that's around being an expert in her own experience of how she feels in that journey. And in the story that she's sharing are her feelings to feel, and they help guide her through sharing her story, as I said. So does that make sense? Yeah. So Ali, what I'm going to do is just invite you to pick a touch point that you would like to share a story around.
Okay. My learning of AI, I'll pick that one.
Okay. So, and then if I just show you the next slide, so then you'll start to see the emotion words around that experience of learning AI. And I'll just invite you to just have a look and choose whatever jumps out at you, whatever you sort of connects with your experience.
Connected, I'll choose that one. Excited. Fortunate. And I think I'll choose my own, and I'll choose disappointed in that blank one there, on the other side, not the green side, the other side.
Okay. All right, thank you, Ali. So yeah, so if you want to just sort of begin to share your story around your learning of AI. I see that you picked connected. Tell me a little bit more about that.
Okay. So I was really lucky to Belinda. I'd heard a lot about Belinda Dewar, and I'd kind of like looked at her resources and, had a little play around with them in the old role that I was in before this role. And I'd heard that you, Lou, and some other people in Southeast Sydney had worked with her in the project before around student midwives experience. And it just sounded really great. Yeah, I loved it. And what I'd heard about the project and mentoring and the students and the mentor relationship, and also what I thought AI was about, I really liked it. It kind of sat really well with me. I've been nursing for a long time and been in healthcare for a long time, and I did feel like we could have notched that up a bit, the way that we do kind of support people as they're going through their journey, and also this around, often we do always seem to kind of always be looking for the problems and kind of trying to fix things all of the time, and there is so much that we do really, really well, and it would be great to spend a lot more time on that as well and celebrate that, and I loved the whole positive psychology and all of that kind of thing that I was also delving into at that time. So I was really fortunate, and that's one of the words that I've just picked, to be part of this second project with Belinda Dewar in the role that I was in now. And So we had some webinars with Belinda. She was from the UK, so they were early in the morning for us and late at night for her. And yeah, I was just so excited to meet her, be part of it all. And what she did do was she provided this space. Because she's a guru and she can do it so well, that we felt really well. I felt like we were really connected with everybody else, even we were in this virtual space. So with the mental midwives and all of these people that we'd not met before that were coming together to do this project, I felt really connected. And I think that was the tools that we used, as well as Belinda's expertise in an appreciative inquiry, helped me to feel very connected.
Okay, thanks, Ali. And you talked about excited as well. And I'm just curious around when you've chose that you felt disappointed. Tell us more about that.
Okay. So yeah, it was great. I was loving it, and I was really excited, and I was very fortunate to be doing that, and I knew that I was very fortunate. And But towards the end of our learnings with Belinda Dewar, there was a project that was going to be rolled out through Southeast Sydney, the MIM project, the Mentoring in Midwifery project. And I share my role with Jules. We've got the same role across the district, but we have different things in each of us in our portfolios. So it came that Jules was going to go with you, Lou, as a mentor midwife and really focus on the mentoring in midwifery. And I was going to take a different project and go down a different path. So I felt a little disappointed that at that time that this felt like it was coming to an end for me, that I wasn't, with the appreciative inquiry, because I was going to have to refocus and go down a different path. Yeah.
Okay. Thanks, Ali. And I'm just curious as well around when we talk about your learning of AI, is there anything else that you want to share around that experience just as we're finishing up your story?
I suppose just then at that point when I did when I was coming to the end of the webinars with Belinda, and she was kind of moving away and the project was going to happen, and I said that I was feeling a little bit disappointed. I kind of really had to kind of reframe about what I could do with appreciative inquiry, and I suppose I knew that wasn't at this moment in time going to be part of the MIM project, but I just had to kind of have a think about, because it does resonate with me so well. I was so fortunate to have the learnings. I had to really kind of reframe about where I could take this into, and how I can kind of get these ripples of appreciative inquiry going, kind of, teach others or get other people on board or give them some awareness about what appreciative inquiry is all about. And kind of feed it into the projects that I was doing in whatever way that I could. Yeah.
Thanks, Ali. And I really love what you just shared there, because it really sits in that space of what we focus on grows and expands. Yeah. So when we start to look at what's possible with what we have, then we start to find, I guess, different experiences and different opportunities, which is great. Okay, thank you for sharing your story.
Yes, thanks.
I'm just keen if anybody wants to share what they kind of thought about that role play, if you like, or real play, and actually using a tool to capture a story. Although it was in Ali's context, if this was something that you felt you could use in your own context.
I think the process has the virtue of creating a really safe space. Not us or me.
Michelle, just put your mic down.
Sorry, that was my cup of tea. I didn't want you to hear me drinking that. Sorry, I think it really creates a sense of safety for the person who's telling you the story, because you're not pushing what you want to hear on them or what you're curious about. You're actually letting them frame the boundaries of what they're prepared to talk to you about, and focus on what's really important to them. So you do get that sense of what's actually really important to them, as opposed to, I'm really interested in how you felt about your pain management. It's like, well, that might not have been important to them. It might be the temperature of their cup of tea that's more important. So they get the chance to put forward that stuff.
Mm-hmm. And also pain management could actually be a touch point, couldn't it?
Yeah,
Because
could
it's
be.
a point in their journey as a patient. So then that
Mm.
might create more space for them to share their experience around that.
Yeah, yeah, yeah. But the other thing too, that by having emotion words that are not just positive but negative, is you give them a permission to be. I don't like to use the word negative, but to talk about things that didn't go so well for them. And I often feel when we do patient satisfaction surveys and that's that rationale behind getting an external person to do them. They don't really want to tell the nurse who's looking after them or who's maybe involved in their care, or if you're working with a new grad or someone like that, they don't want to tell their supervisor that because they're concerned about the comeback if they say something's not what I expected or it's not as good as it should be. So I think that gives them permission to raise things that they might think you don't want to hear. Yeah.
Yeah. And also in that, Michelle, you might find that people might pick a negative emotion, but it's just explain something else that's happened that then brings them into a positive experience as well.
Yeah.
And that's the power of using this tool that we don't actually know,
Yeah.
because it's the
Exactly.
person who's sharing their story, isn't it?
Mm.
Okay, so we're just going to use
I'll just say, sorry,
Yep.
Lou, that because I haven't done this, I haven't had my story taken really just once before, but having those emotion words there helped me to kind of just being able to see them, just helped me to be able to really kind of connect with how I felt in the story. It helped me to kind of just be a little bit more open, I think, and be able to articulate my story a little bit more.
That's great, Ali. Thank you for doing it. So we're just going to have a think about what Ali shared, and we're just going to take the opportunity to just give you another tool to take away with you. And really, this is just to generate a bit of discussion around Ali's story, really. And then so the first thread around this tool, which is called Life Sessions, really ultimately its goal is to generate deeper discussion. So this might be something that you could use with your teams, around an experience or a story that staff have shared, or if you have opportunities to share patient stories or patient's experience at any meetings or any huddles or anything like that, then it just gives us a bit of an opportunity to generate a little bit of curiosity around that, and how we can celebrate and how we can maybe change our practice. So is there anything within Ali's story that you heard that you would like to celebrate in that? I think for me, to share what I would like to celebrate and what I heard is that even though there was disappointment within the space, it was the celebrating the opportunities to use this in another way and to wrap it around other parts of your work. Oh, Dan's typing.
Thanks, Dan.
Is there, oh, what did Dan say?
He said, I would like to celebrate Ali's vulnerability in sharing her story, both positive and not so positive experiences. Yeah, yeah, it is. It does make you feel a bit vulnerable, but I wanted to share.
And is anybody still wondering about anything? Is there anything that you're curious about, that you'd like to know more about?
So I'd like to know, Ali, how it's gone working with Appreciative Inquiry in those other avenues.
Yeah, I think once I'd got my head around the fact that I had this learning, and yes, I wasn't a guru like Belinda and all of the rest of it, but I could share what I already knew, and I was very fortunate to have been in that space with Belinda. So yeah, it's gone well. This is why we're here today. So it's still happening, and a lot of the work that I'm doing, and I think at this time as well, I don't know, more than ever after the last few years that we've had as well, I feel, and it might be a massive assumption that yeah, like I say, it could be a huge assumption that people are more open to this. We've been through a hard couple of years, so people are wanting to connect. You're seeing connection so much, and the connection and the resilience, and with the teams as well, that has got people through COVID and all the rest. There's been a lot of sharing, and I think appreciative inquiry sits really well with that as well. You know, so I think it's a good time too.
Thank you.
Anybody else wondering about anything? Dan's just typing. Okay, so if we have a think about, and this is just sort of in the interest of time as well, but have a think about actually seeing the role play around how to take a story using that tool, and kind of that underpinning appreciative lens in doing that. Is there anything that anybody hopes going forward, or what you heard Ali share? I think for me going forward, I hope that this is something that people feel like they can give a go, when we are capturing our, I guess, patients, carers, families' experience, but also it's a good way to capture staff experience as well, and understanding, yeah, how you can unpack it as well, going forward.
Yeah, Dan said, I hope going forward to use AI and emotional touch points to enable staff and patients to share their stories in a safe way.
Thanks, Dan. Ruth's typing as well. And this is something as well that you can just have a practice, give a go, before you get into that space of actually doing it with someone. But you could practice it with each other, or you know, give us a shout if you wanted us to give it a go with you. Happy to do that.
I'll just read Dan. So Dan said, starting the conversation or taking a story can be daunting. Having a tool to enable that and make it easier to engage in storytelling and story receiving is such a gift. Yeah, absolutely. Yeah. Yeah, and the tools they really help with that. It's like something solid that you can use that really help with these, these curious conversations, these curious questions, that's what it's all about. Jackie's typing. Ruth said, yeah. Ruth said, I hope to use this tool. Great to have a real example. Thanks. Yeah, great. Thanks, Ruth.
And actually, Ruth, what's really good with this tool as well is that as part of the quality framework in capturing data at Prince of Wales, I know that Karen had sort of looked at and introduced emotional touchpoint stories as a way of capturing staff and student experience as well. So it's a really good way to understand where people, where people are at. So just around this tool, I guess, is there anything that anybody would like to ask after discussing the story? Oh yeah, Ruth's just said she's been looking through the resources. It's a different approach to the one you've used in the past, yeah. Okay. So that just brings us to coming to the end of the webinar. I'm just interested to know if anybody noticed anything that popped out in using that tool. Ruth's typing again. So if we look at the celebrating, I mean, that's pretty obvious, right? The tool itself asks you to ask and unpack the story around celebrating and to have a discussion about that. I guess it's pretty courageous in actually taking the story, as Dan talked about. You know, it can be daunting taking a story, but it's also daunting to be the story sharer as well. So there is an element of trying to enable people to be courageous in that. And that's what the tool helps to do. It creates a bit of a structure and a guide around doing that. We're using feelings. So we're always connecting emotionally in that space. You know, curiosity pops with the fact that we're capturing someone's experience, as well as considering other perspectives. Sometimes when people share a story, what it does is it helps to challenge our own assumptions around their care and their experience. And some of the things that we might think have worked well may be the complete opposite, or things that we've not even thought about in providing care or experiences for others. It is collaborating, because sometimes the power of a story can change our practice and shift how we do things. So we're working together with our consumers to do that. And sometimes we might actually have to compromise and get to a space where we have to create something new together. And that might be practice changes, it might be environmental changes. So that tool in itself helps us bring the caring conversations and that relationship-centered practice to light. So just before we go, is there anything that you would like to tell people? So in a closing, yeah, Ali? Yeah.
No, it's okay.
Sorry. Is there anything that you would like to tell people about today's session moving forward? No matter how little or small it is, we'll just do a quick closing round. I would like to tell people that it's actually doable to take a patient or a person's story using emotional touch points virtually, because I was a little bit daunted by that.
Is that the first time you've done it virtually, Lou?
Being the story taker, yes.
Yeah. Well, no, you were able to take my story, so yeah, it worked. I'd like to tell people, yeah, just to give it a go. I feel like, yeah, you make so many assumptions, and I think sometimes we can feel awkward ourselves, but that's an assumption that other people are going to feel awkward in this space, and they might not at all, you know. So just give something a go and try and just be courageous there, and yeah, and don't bring your stuff into it, you know, your negative stuff. Just don't make assumptions, just give it a go and see what happens.
I think just about using the tools and resources available, because you can see how much it helps guide the conversation, and it's helpful, as you said, to not just yourself but the person telling the story too. So why not make it easier if we can?
Yeah, thanks, Jackie.
I think I'd like to tell people about the process, and you know, with my safety and quality facilitators, it would be quite a useful thing. They don't at this stage collect patient stories, and I think that's because they've no idea where to start. And I think I'd tell them that this is a really good way to create a safe space for people to tell their story.
Thanks, Michelle. And Dan has just said that he would like to tell people that it's about finding small ways to use it each day and practice it over time. Thanks, Dan.
Thanks, Dan.
It's Wendy here. We were doing patient stories for Pete, Michelle, a few years ago, and someone brought these emotional touch points in, but we really didn't know how to use them. So thanks for today. I think I'll be more confident using them now.
Yeah.
And do you think it's because the person chooses the word they use that it makes it easier to ask them more about that? Is that the idea? They're more open about it. It's their word.
Yeah, and I think what happens, well, for me anyway, is the more you sort of become comfortable in taking stories and being the story taker, you develop your skills in listening. Do you know what I mean? So then when you're listening, that it makes you maybe a little bit more curious. And then because the person's more at ease as well, because there's a bit of a structure and they're sharing how they feel, I've just felt in my experience that it makes it a little bit easier to feel like there's no power imbalance. There's no, it just feels like it's sort of weaving back and forth.
Yeah. Wendy, I went to Belinda Dewar's talk when she was out in Australia quite a while ago, and she talked about this process, and I thought it was a really interesting process, but I wasn't sure about where to get the tools and how to actually do it, you know, in the way that I think I've grasped today. So yeah, I agree with you, Wendy. It would be a useful tool, but you have to understand how to use it.
And Dan's just shared again, it's very person-centered, allows the person gifting their story to have it shared at power in the moment.
Absolutely.
Thanks, Dan. And Andrew, is there anything you would like to tell people or share about using this or this way of working?
I guess more than what I'd like to tell people, I guess going back to the previous one, which is ongoing too, and start using some of these tools, just easy, simple, unthreatening, open-ended questions, just to help expand the story.
Thank you.
Thank you.
Thanks.
So just as we head off, thank you very much, everyone, for being part and sharing.
Yeah, thank you.
And being so involved. It's been great, and we always enjoy coming into this space. So we just have a QR code there for that quick evaluation, because that helps us to sort of develop and create this space for you. I'll leave that up, and then coming up next is some QR codes for resources, web pages, and then the webinars, videos that are already recorded on YouTube. Just give us a thumbs up if you've done it. And our next webinar will be on the 3rd of February. And that will be looking at, we can't change other people, we can only change ourselves. So we'll dig deep into our toolkits to see what we can share with you around that statement there. And same as usual, just get yourself onto My Health Learning and sign up.
Yeah. Yeah, and then there's just another 2 after that as well, and that's the 7 that will be in this series.
Okay. And we can send these out via email as well to all the participants and all the people who've been on, so that you get the QR codes for the webinars. So that's just to give you the links there. And then just additional resources. So you'll be familiar with these now, given that you've all been on before. But My Home Life Scotland webpage is where all of the tools, especially the virtual ones, live. And then there's a lot of tools and resources that are on our nurse and midwifery practice and workforce unit site. Okay, so if there's any questions or anything, let us know. But otherwise, hopefully you all have a lovely Christmas and New Year.
Yep.
Eat, drink, and be merry.
Once we've got the housework done and the presents bought.
Yeah, that's it.
Which I've bought one present so far, so.
Yeah, I'm not that far behind you, Michelle.
And that was something I was told specifically what someone wanted, and I ordered it online. That's the extent of my Christmas preparation so far. Anyway, that's life.
Thanks,
Thank you,
Dan.
everyone.
Thank you.
I really enjoyed it.
Dan.
Thank you.
See
Bye.
you later.
It's nice to see you all. So have a great Christmas, everybody.
Bye.
Thank you.
Bye.
Bye.